Welcome everyone to our Levitt lecture. And first of all, thank you for taking time out of your busy days to join us for what I think is going to be a really great lecture today. I'm Myra Muramoto. I'm the department chair for family medicine. And I also want to thank all those people online for really helping proliferate our good work here. So I'm really pleased to welcome you. Just a little bit of history about the Levitt Lecture is Dr. Louis P. Levitt was born in Denver in 1896 and graduated from CU School of Medicine in 1927. He practiced medicine in Denver for 40 years until 1967, and when he passed away in 1978, he left a generous gift of $75,000 to the Department of Family Medicine for the purpose of establishing the Levitt Distinguished Speaker Series. And it really reflects his lifelong commitment to achieving medical knowledge and improving patient care, especially for primary care. So our purpose is to invite distinguished speakers from many walks of and areas of relevant to primary care and family medicine, and that have particular relevance to CU and the communities and patients that we serve. So, and really with a goal of staying current and educated, especially as family physicians. It's a lifelong journey, and we're really pleased to be able to continue this lecture. So today's topic, we're really excited to invite Dr. Edward MacPhee and Dr. Amy Sholler Dreier, both from the Department of Psychiatry here at CU, for their talk, Finding Meaning in Medicine presentation. And it really explores what's the search of meaning? I've heard it said that humans are meaning-making machines. And what does that search for meaning mean, central to being human? And then how does that translate into the rest of our lives, and then also to our work here? They're going to introduce a balanced model of meaning and how it can be applied to life, work, and medical leadership to create more meaningful environments. And we deliberately chose to host this talk during November, which is a time where we reflect a little bit. Thanksgiving's coming up, and particularly at this fraught time in history in our country, where we thought this was an important time to really kind of reconnect and meeting. So about our speakers here. Dr. MacPhee is a trauma psychiatrist and associate professor in the Department of Psychiatry at CU School of Medicine. Works closely in the inpatient and outpatient settings and oversees the hospital-based parts of the adult division of psychiatry. Dr. MacPhee has been interested in the topic of meaning and its role in mental health for over 15 years. He's an integrationist and is especially interested in how philosophy, psychotherapy, positive psychology, and psychiatry can be brought together to improve treatment. Dr. Dreier is a licensed psychologist and assistant professor at CU Anschutz School of Medicine. She's the director of psychology for the adult division of the Department of Psychiatry. She specializes in delivering evidence-based therapies for a variety of psychiatric conditions with a specialty in trauma and PTSD. In addition to therapy, Dr. Dreier also provides psychological assessment, psychotherapy, training, and supervision for the psychiatry residents and psychology trainings, and is involved in various quality improvement projects. Just to remind you, the event's being recorded in case you miss anything, and it will be archived on our website. Some people may need to leave around 1, so just to tell our speakers they're not walking out on you. And it's really important that you take our short survey at the end. We take your feedback very seriously. What's up screen is a survey that is relevant to Dr. Dreier's portion, and it's also on the tables, and it's being posted in the chat. So welcome. Please give a warm welcome now to Dr. MacPhee and Dr. Dreier.
Hi, everybody. We are really excited to be talking with you all today about a topic that's near and dear to Amy's and my hearts, finding meaning in medicine. And we really hope that you find this to be valuable and a meaningful presentation as well. Usual disclosures, nothing for Amy and I to talk about here, so we'll move on and talk a little bit about what we're going to be covering here today. We're going to be creating a new narrative or a story about meaning, because I think that a lot of you came here today because you feel like meaning is important, but meaning is a concept that's really difficult to define. I was taken with this quote by Wittgenstein: "The limits of our language are the limits of our world." So we're going to try to address this problem. We're going to talk about the balanced meaning model and how we can use it to better understand meaning, and then we are going to apply it to our lives in general and then to our jobs. So we're going to start from the general and to become more specific over time. So let's start with the question: what is meaning? Well, a lot of people posit the idea that there are two levels of meaning. There's the meaning of life, which includes questions like, who am I? What is this universe that I'm in? Why am I here? Very important questions, but very difficult to answer those questions. And that's the meaning of life. Meanwhile, we have what's called the meaning in life, which is a lot more specific, and it's something that we can actually use. And that's what we're going to be focusing in on today, and what has been focused in on from a psychotherapy and a positive psychology perspective. Of course, we would be remiss to have a conversation about meaning without talking about the great Viktor Frankl. And I'm sure a decent number of you here in the audience have read his Man's Search for Meaning. Viktor Frankl was an Austrian psychiatrist who was also Jewish, and as a result, he was put into the concentration camps during World War II. Interestingly, prior to going into the concentration camps, he started to develop his own form of therapy, which he called logotherapy, which is a meaning-making therapy. And then after being in the concentration camps, after he got out, he wrote Man's Search for Meaning, which talks about the importance of meaning in terms of surviving the time in the concentration camps. Frankl put forth the idea that we have a will or a drive towards meaning. And he talked about meaning, a lot of it was talking about the idea of having a sense of purpose in life, particularly in the moment. And he defined three pathways, or we'll call domains, of meaning in life. Experiential, such as talking with you guys here today. This is an amazing and scary experience. But watching the sunrise or watching the snowfall on a cold winter day. There's also creative meanings, which is bringing forth something into the world or helping out other people. This is often used synonymously with the idea of having a sense of purpose, but they're not exactly the same thing. And then finally, Frankl talked about attitudes, particularly one's attitudes towards unavoidable suffering, and how we can choose our attitudes even under the worst of circumstances. So this is one model of understanding meaning. We also have the positive psychology model as well, which is more research-based. Initially, positive psychology focused a lot on having a sense of purpose, but eventually spread out into the tripartite model, which focuses on coherence or sense-making. So what does this mean to me? Significance, do I mean something? Am I of value? Do I matter? And of course, having a sense of purpose. So let's talk a little bit about how they relate. Sorry, the slide here is in yellow, but I would say that there's actually a tremendous amount of overlap between the two of them, but there are differences. For example, Frankl's model has the experiential domain of meaning, and that doesn't exist in the tripartite model. There is some evidence from the positive psychology literature saying that experiential meaning is a thing and it is important, but it's not necessarily part of the model. Meanwhile, there's creative meaning versus having a sense of purpose, which, as I said, not exactly the same thing, but a lot of overlap. The tripartite model has the cognitive component, the coherence part. And then there's also the interesting attitudes versus significance, which it's hard to figure out exactly what those mean. And I would actually put forth the idea here that they're related concepts, because our attitudes are always about something or someone. And significance means that we are being valued by something or someone. So I would say both of them are aspects of relationships. So maybe we're talking about relational meaning here. One definition, there are a lot of definitions of relationships, but one of them is the way in which two things are connected. And I think that hits the nail on the head for what we're talking about here. And our attitudes are opinions that influence how we relate, and valuing is a specific type of attitude. And we'll expand on this idea in a little bit. So this gives us 4 domains of meaning: relationships, cognitive, I'm not going to use the term coherence, it's not a term that most people use, purpose, and experiences. And for those of you who are familiar with psychotherapy in the various forms, this actually covers a lot of the types of psychotherapies that are out there, which gives a bit of credence to the model. So let's go back to this idea of what is meaning, because we've hit on the domains, but that doesn't really explain what meaning actually is. So going back to Frankl, paraphrased a quote from Goethe, if I accept you as you are, I make you worse. However, if I treat you as though you are what you are capable of becoming, I help you to become that. So it's a really powerful quote, and it's the idea that if we see the person in front of us as the ideal version of themselves, then we can help them to become the best possible version of themselves. And Frankl talked about this being a combination of a realism and an idealism. And I think that hits the nail on the head here, that this is an idealism that is grounded, it is more balanced. It is not a pie-in-the-sky dreamer sort of idealism. It's one that is balanced with reality, and then there's also a pragmatic element to it. So this is more the definition of idealism that I think Frankl was going after. Let's talk a little bit about the 4 domains and how they would tie into idealism. Let's start with experiential meaning. Experiences are what we are consciously experiencing at any given time, particularly our sensory experiences. Our external ones, such as sight, sound, and smell, but then also our internal ones, such as interoception, which is where we start to connect up with our emotions because we feel our emotions somewhere in our body. But this raises the question, what leads to our emotions? Well, I'm going to put forth the idea that they're a measure of congruence. And this idea comes from Carl Rogers, another one of the great humanistic psychotherapists. He described congruence as being the overlap between the actual or real self and the ideal self. And I think there's some merit to this idea, and we can use it here if we expand it out beyond just our conceptualization of ourselves. So congruence becomes the degree of overlap between the ideal and the real. And when there is a high level of congruence, there is a large overlap. But we very rarely will get full congruence. Very rarely will the 2 circles overlap. So we very rarely will hit the ideal. Meanwhile, there's also incongruence or low congruence, where there's very little overlap. And I would say this is what happens during a traumatic experience. And I would also put forth the idea here that this is unfortunately all too common in the world that we live in today. There is a big disconnect with a lot of the things that we're seeing going on in terms of the reality to what we think or feel should happen, the ideal. Now, what's interesting about congruence is that it is experienced via our emotions. So when there is high congruence, we end up with our pleasant emotions, such as joy or excitement, love or awe. But when there's low congruence, that's when we get our unpleasant emotions, such as sadness, anger, or fear. So that's, I think, a good place to get started, but it still doesn't fully allow us to understand where the emotions come from. It would happen at an earlier stage. So this is where we tie into relational meanings. This is when the congruence is actually assessed. This happens unconsciously. With whatever we are focusing in on at a given time, we're looking at it through the lens of what's actually happening versus what we hope would end up happening. And this gives us our initial relationship or perspective, and our emotions are our conscious manifestation of it. So it happens unconsciously. We don't have access to the information, but we do have conscious access to the downstream results. What's interesting about relationships is that we don't have to stick with the initial perspective. We can change it and do a conscious reappraisal, so creating a secondary relationship or perspective. And I would put forth the idea that we are constantly in relationships. We are relational beings. And it does not just interpersonally, but with everything in our lives. And we'll get to that a little bit later. So let's talk about cognitive meanings, the third part of our the 4 domains. This is a picture of my son Xavier and our dog Astra. And for those of you who are paying attention, in the background are the Great Sand Dunes. I think this is what makes us uniquely human, our ability to think. I love our dog Astra. She is wonderful. She's very relational, man's best friend. She has emotions. She acts with a sense of purpose, but she doesn't have the ability to think at the level of our son or any of us here in this room. We gather information and we form our opinions. We shape our understandings and our goals. This is part of who we are. It's what makes us uniquely human. And we also have the ability to imagine and to dream. And the better that we understand ourselves and the world that we live in, the better that we can connect with and bring forth the ideal. So this is our tool, this is our blessing, if you will, the ability to think, and it's what separates us out. And then finally, we have a sense of purpose. I think we always are acting with a sense of purpose. That's what we do. Whether we realize it or not, we're always working towards specific goals. And there are 2 aspects to having a sense of purpose. The first is making choices, and then the second one is putting them into action. And sometimes we can see them because they're behavioral actions, but other times they're cognitive changes, such as changing your attitudes. And it's through having a sense of purpose that we can move closer to that ideal. We can change the level of congruence. So I would actually say that there is a large overlap between meaning and idealism, and go as far as to say that the quest for meaning is the quest for the ideal, and how we understand how close we are is through congruence. And we're always working to improve congruence in our lives. The problem is that most of us don't actually realize this is what's going on. And if anything, nowadays it's really hard to be an idealist. We see a trend starting in the early part of the 20th century where a lot of horrible things happened. World War I, the Great Depression, World War II, Vietnam, Watergate, leading up through and including today. It's hard to be an idealist. It can hurt, right? Because it's connected with our sadness, anger, fear emotions. But I think it's very important to kind of keep this idealism alive. And I think the balanced meaning model actually helps us to do this because, again, it's not a pie-in-the-sky dreamer sort of idealism. It's a balanced idealism. And it helps us to understand, to capture, and to work towards the ideal, and to allow us to live our best possible lives. It'll never be perfect, but it'll be better than the alternative. So let's move on to meaning in our lives. Going back to the balanced meaning model, one aspect I didn't highlight was how interconnected the 4 domains are, and how it's very important that there is a balance between them. So if you're very strong in 1 or 2 areas, that's great. But if you're weak in the other ones, it's going to throw off the entire balance. Thankfully, we can do things to improve meaning in our lives. We can do the things that we find inherently meaningful, and we can minimize the things that detract from meaning. So let's go through the 4 domains here and give some examples. Let's talk about the relational meaning in life. I would say this is something that in Western culture we're not very good at. This is one of our weak points. So we can look towards cultures where they do it better, and one of them would be indigenous cultures. They tend to take what we're calling a more of an omni-relational approach towards relationships. And this not only includes interpersonal relationships, but with pets like Astra, our social networks, institutions such as CU Medicine, objects such as the microphone that I'm holding, ideas such as meaning, nature, higher powers than ourselves, and also ourselves. So we live in a complex, interconnected web of relationships, and we are never actually fully alone. And this is something that's important for us to realize. Now, we can also think of our relationships in terms of the strength and quality, and this comes from the literature on the therapeutic alliance in psychotherapy. We can think of the S and the Q, and we can put it into an equation. You know, I don't generally think mathematically, but this is actually a nice way of doing it. And we can think of the strength from 0 to 10. And if it's a 0, it means that you have no relationship. And we can think of the quality as being a -10 to a +10. So you can have a negative relationship overall. And then you can sum up all of these relationships because, again, it's not just 1 or 2 relationships, it's all of them. Let's move on to valuing, which I had mentioned previously and I think is an absolutely critical part of relationships. As I said before, we choose our attitudes, and we can choose to ignore the things that we're relating to, and we can also choose to devalue them. But this has a negative impact on the SQ, right? So if you ignore it, then you have a very low SQ because the S is low, and you can go down to 0. And if you devalue, then you can end up with a negative SQ. But if we choose to value, we get something much more positive overall. And the quote from Goethe is a perfect example of that, but also another idea from Carl Rogers, that of unconditional positive regard, which he described as a prizing of the person that we're working with. These are 2 pathways towards valuing the different things that we are relating to in our lives. And I think it can be mutually beneficial, right? It helps me and it helps what I am relating to. And it ties into the research on significance or mattering, which is kind of an underdeveloped area of positive psychology. I would be remiss to not talk about our relationships with ourselves, because I've met some wonderful human beings who are the kindest, most compassionate people that I've ever met, who also don't treat themselves very well. When I run into a patient who's got this particular problem, I'll often refer to my version of the golden rule, which is treat people the way you would like to be treated, including yourself. And I think this ties into the vast research on self-compassion. Let's move on to experiential meaning in life. I think just like we talked about with idealism, we can become disconnected from our experiences because they're unpleasant. Sadness, anger, fear are not easy things to experience, so we can back away from it. But when we back away from our unpleasant emotions, we also back away from our pleasant emotions too, and we become disconnected from all of them, which is something called experiential avoidance. But if we avoid our emotions, then how do we connect with and understand the ideal? Becomes really difficult, if not impossible. So it's important for us to be open to all of our experiences, good or bad. And this is actually an important part of psychotherapy outcomes. It's also, interestingly, the first step in authenticity. How can you truly be yourself if you don't connect with all aspects of yourself? This ties into the concept of experiential range, which is shown up in positive psychology as well as philosophy. It's beneficial to have a range of experiences. It's beneficial to go to the great sand dunes or to watch the snowfall. But we also have to take the good and the bad, and we have to take the unpleasant emotions too. And the unpleasant emotions aren't necessarily bad. Note that I'm saying unpleasant as opposed to bad, because they foster a growth mentality. These are, when we have the unpleasant experiences, we can think of them, like Frankl did, as being challenges and opportunities to grow in ways that would have never happened if things were going well. So there's the idea of a Latin quote, per aspera ad astra, which is through adversity to the stars. And you'll note that I said that my dog's name is Astra, so that's not really an accident. There's also a wonderful quote from Nietzsche: "You must have chaos within you to give birth to a dancing star." But it also ties into the logotherapy concept of finding meaning in suffering. It ties into the monomyth, Joe Campbell's monomyth, or the hero's journey. And from a positive psychology literature, it ties into post-traumatic growth. Interestingly, there's the idea out there that if you just stay comfortable, that's actually experiential avoidance. So if all you're doing is playing on your phone and eating good food, and maybe sometimes it gets into alcohol or drugs, these are things that keep you comfortable, but they prevents you from facing the challenges that you end up facing. Next up in experiential meaning, I'd be remiss to not talk about savoring, because Amy and I did a grand rounds for family medicine on savoring and gratitude last year. And the reason for that savoring is important is that we tend to focus on the negative in life, right? And that makes sense because, again, these are the challenges that allow us to grow. But we can focus too much on it and lose track of the positive. So we have to actually make the conscious effort to capture the positive in our life, the pleasant emotions. And can't go through all the different types of savoring, but 3 of them I want to share with you. One is sharing with others. This is actually the most potent form of savoring, is sharing the good news. So talking with you all about the exciting things that have happened helps me and it helps you. Absorption, which is getting totally engrossed in the moment. So it's much more of an experiential savoring. And for me, I love to listen to electronic music. I have for 30 plus years, and I can get lost in the music. And this concept overlaps with flow as well as mindfulness. And then finally, given the season here, there's gratitude, giving thanks for the positive things that have happened and the experiences that we've had. The final thing I wanted to capture under experiential meaning is spiritual experiences, because we often don't talk about this. But this is connections with something greater than ourselves, such as Mother Nature or higher powers. This is something that is a critical part of our lives. And when you have these experiences, it can change your life dramatically, provided that you figure out what they mean to you, that you find the cognitive meaning of it, which is why psychedelic-assisted psychotherapy wraps up with the integration phase. That's finding the meaning behind what happened. Lots of different examples of spiritual experiences ranging from the more common and less profound of flow and mindfulness into the less common but much more powerful awe and peak experiences, as Abraham Maslow had described. Let's talk a little bit about cognitive meanings in life. I buy into the constructivist idea that we use models to understand our lives, right? So if you think about it, I'm a psychiatrist. I have a model in my mind of depression that includes things like the pathophysiology, the diagnosis, and the treatment. And interestingly, these models have changed a lot since I got started with my training in medical school way too many moons ago. So these models are just models. They are meant to be updated. They're meant to be changed. And it's also important for us to remember that the map is not the territory, right? So just because I have a model in my mind about what depression is, it helps me with the person who I'm working with, but it doesn't tell me everything. And it's important to remember that this is a person, not just depression. This also ties into the idea of intellectual virtues, which is an outgrowth of Aristotle's more behavioral virtues. And I think the intellectual virtues are very important in this post-truth era that we live in. The 3 most important that I want to mention here today are open-mindedness, being open to new ideas, and figuring out, okay, what does that mean for me? Also curiosity, the desire to learn more, and then humility, being able to say, I don't know it all, and that's okay. And then finally, for cognitive learning is the idea of lifelong learning, which I think is something that attracted people to the medical professions to begin with. We want to continue to refine our models and to constantly learn. That's how we can bring things closer to the ideal. And this is particularly important during periods of rapid change. I would also throw out the idea here that nowadays, as adults, we don't learn a huge amount from lectures like this, or from journals, or from books. We actually do the bulk of our learning experientially through our interactions with people and the problems that we face in our lives. But how do we capture that? And that's actually where reflective learning comes into play. I'm a fan of Donald Schoen's model. I'm paraphrasing it here, but reflection during action. What can I learn from this experience? And then reflection after action, such as at the end of the day. And then finally, there's a sense of purpose, and that's its connection with meaning. We will go into the poll here in a little bit here, but I'm willing to bet that one of the main reasons why people went into the medical professions is to help others. And that kind of brought up the idea for me of the 3 degrees of influence. There's good research out there to support the idea that when we're helping somebody, we're not just helping that one person, we're helping their friends and family and their friends and family. So it spreads. The good word spreads, but so does negativity, right? So it's not just good that spreads, the negative does as well. So we can make a very profound difference, a lot more than we think about. Next, I want to talk about purpose in the moment, which is something that Frankl spent a lot of time talking about. It starts with thinking about meaning and its salience to the situation that you're in. And Frankl had framed it in the nice way of, what is life asking of me now? So making it personalized, present-centered, and making it a challenge. And then we can envision the ideal, our imagination, and work towards it. And this is actually, interestingly, ties into the concept of positive selves, which predates positive psychology, but it would fit nicely under there. When kids at the start of their elementary school year envision themselves being successful, lo and behold, they become more successful by the end of the year. So having that image of being successful in your mind is actually important, and I think it spreads out into a lot of different areas. And I think all of this ties into hope, which is a very powerful concept, and I think this is something that's lacking today. Finally, I'll wrap up my part of the conversation here by talking about long-term purpose. This is getting more into why am I here sorts of questions. Frankl often quoted Nietzsche, "He who has a why to live can bear almost anyhow." But how do we find our purpose in life? Well, the logotherapist Joseph Fabry put forth the idea of logo hints. And what I would encourage you to do is think about, what are those things that you've been drawn to over the course of your life, that you found interesting, that you find cool, that brings you a lot of pleasure? Well, these are logo hints. They give you ideas about what you find meaningful. And it's important to put these together and figure out, how do I bring them forth into my life? And this workbook here that I mentioned is actually a good one for trying to capture that. So I've covered meaning in life, and what we're going to do here is I'm going to hand things over to Amy, and she's going to talk about a specific aspect of meaning, which is meaning in our jobs.
Okay, thank you, everyone. I'd like to walk us through how we can develop some purposeful, deliberate practices for connecting to our meaning at work. Before I jump into that, I just want to do a little level setting. So as Ed alluded to earlier, each one of these components of this balanced meaning model really could be a course in and of itself. And so what I'd like to do is really just plant some seeds for you all, some ideas that you can kind of feel what really resonates with you, and then maybe take to do some research into how you want to develop some deliberate practices for yourself. Another thing is, I'm coming at this from a particular frame of reference as a psychologist. So a lot of what I'm going to be proposing to you all comes out of the psychotherapy traditions and research. And there's a lot of other sources of wisdom that can be applied here. There's wisdom that comes from faith traditions, from indigenous knowledge. So I just encourage you all to be curious about not only what I'm presenting to you as ideas, but other sources for wisdom when it comes to applying meaning in what you do. And there was one other thing I wanted to tell you. It'll come to me. So we'll move into, I want to expand on that quote that Ed just alluded to a few minutes ago from Viktor Frankl's Man's Search for Meaning, because I think the full quote really applies nicely to what we do in healthcare, and particularly that beginning part where he says, "A man who becomes conscious of the responsibility he bears towards a human being who affectionately waits for him or to an unfinished work will never be able to throw away his life." And then he knows the why for his existence and will be able to bear almost anyhow. And I think this really highlights meaning for us in healthcare when we think about what we're doing for other people, whether it's actually seeing patients or whether it's engaging in research, discovery, innovation, all of these things that are focused on helping others. So let's keep that in mind. Our jobs are a really critical part of our identity. So when you meet somebody at a party or socially and you introduce yourself, you say your name, the first question people tend to ask you is what? What do you do? We identify as, I say, hi, I'm Amy, I'm a psychologist. And I tend to not say all the other things that I am in my life. Our culture is really kind of centered around our occupations and our professions as a big part of our identities. And so while meaning is really important in all aspects of our lives, when you think about the amount of time we spend doing our jobs, it really is a central thing that we need to focus on. So I'd like to revisit our answers from the poll we took earlier. And I'm going to click on this. So this is news to me, too. I haven't looked at this yet. What motivated you to pursue your current job? It looks like 56% of you said to help or to make a difference, which this is my shocked face, right? That's sort of what we expected everybody to say. Some folks say financial stability, enjoying challenges, lifelong learning and growth, educating others, relationships with patients, being respected. It looks like the second highest one is being informed by and involved in research, which is also not surprising because this is probably a pretty curious group of people that likes to learn. So I'm done with that. Thank you. So 56% of us, and we actually forced you all to choose this one thing, right? I'd imagine that those of you who didn't choose number one as helping others, it was probably a close second. Thank you. Awesome. Cool. And the reason we asked that question is that when you answer that you got into this profession in order to help others, that's really what Ed was hitting on as the ideal. So this drive to help others, this ideal to kind of make the world a better place, is what contributes to medical advances. If we didn't have people who cared, we wouldn't be where we are today. And I really like this quote that I found in this article that was from earlier this year on AAMC's website, that's from the first physician who did the first living donor mitral valve transplants, Dr. Joseph Turek, and he said, you start out years earlier with this idea that maybe you can change lives, and then you see it come to fruition. That's a peak experience. And then you think about the thousands more kids who could be helped in the future. So this is that 3 degrees of influence that Ed is talking about, right? Of like when we have an ideal and a purpose and we go for it, it makes a difference in somebody's lives. That feels really cool. And then it's like, how can I keep doing that, right? And that's really what's pushed medicine and healthcare forward. And so these ideals are really important. And I don't think I'm surprising anybody when I say this, that the practice can be a far cry from the ideal. Our day-to-day realities in healthcare can really bump up against some pretty tough things that we have to figure out how to make sense of. The ideals of our system may not be the same as the ideals of the individual. And so providers and staff can face pressures that feel really incongruent with our calling. And you don't have to raise your hands, but I'm guessing this is something that everybody in this room can relate to. It's probably why you're here. And so this is what I want to focus on today, is that a solid sense of meaning can be protective from the more challenging aspects of our system. That is not to say that you as individuals are all responsible for your own well-being and just figure out how to deal with it, right? We had a saying in the Air Force, it was just shut up and color, right? So if the commander says do something, I'm just going to shut up and color. Yeah, we need to take care of ourselves, but the system has to help us. And so leaders really need to find ways to minimize and promote meaningful paths. And I really like a quote that came out of the Surgeon General's report on healthcare worker burnout that came out in 2022. Has anybody read that? If you haven't, read it. Super helpful. Also pretty hopeful, I think. But what they say is essentially we need to take what has been a me problem and turn it into a we problem. We all need to work on this together. So as I'm presenting these ideas to you, I'd like you all to think about how can I do it for myself, but then how can we do it as a team? How can we do it as a system? How can we do it as a society? Okay? So we'll start off with relationships. Ed got to put Astra in. So this is Tim, my favorite coworker, AKA my dog. He has a much less starry name. His name's Tim the Enchanter, which is a Monty Python reference for anybody who gets it. Relationships at work. Ed described that this kind of omni-relational idea that we relate to everything around us. And so we're constantly relating, whether it's with patients and clients or families, colleagues, coworkers, the work itself, the system, leaders and administrators, stakeholders, and then also with ourselves as caregivers or care facilitators, no matter what our role is. And so relationship strength and quality is a really important thing. And it's important for us for meaning, but it's also important for us as how we function and how effective we are in our work. And research has consistently demonstrated that workplaces that have high quality relationships are more effective, more efficient, they have higher satisfaction, lower burnout rates, lower rates of turnover, better retention, et cetera, et cetera, et cetera. So what makes a high quality relationship at work? Well, trust, mutual regard, and active engagement. And what the bottom line really boils down to is that workplaces thrive when employees feel valued and respected. And we're going to talk a little bit more about valuing in just a minute, but what I'd like to propose to you all is that we can really enhance our relationships at work by focusing on kind of our spheres of influence. Where do we have the most control, and investing our time in those places? And then thinking about our attitudes towards the places where we have a little bit less control, and how can we approach those situations as well. Ed mentioned Carl Rogers and his concept of unconditional positive regard. This is really the foundation of psychotherapeutic relationships, but I'll propose that it really applies to any relationship, and particularly relationships with patients or clients, but also with our colleagues and coworkers and anybody that we come into contact with. The basic assumption of unconditional positive regard is that the other, whomever that is valuable and worthy of respect. This is really central to what we do in healthcare if we're thinking of that ideal of helping others, right? In order to want to help others, we have to kind of have an underlying assumption that the other is worth helping, right? And so this is a kind of foundational concept for what we do in healthcare, that we have this unconditional positive regard for the people that we work with and for. It's just that it can get lost sometimes, and some people can make this more challenging than others, right? We've all worked with people that are a little bit harder to be empathic for, or who really kind of push our buttons in some ways, and that's okay, that's really normal, but this is a nice home base to start at. And I'd also like to say that this applies to self too, just like Ed was alluding to. So like unconditional positive regard is for others, but it's also for me. So looking at yourself as someone who is worthy to be of respect and valuing. So let's spend time and energy on who counts. And really the people we spend the most amount of time with are our colleagues and our clients or our patients. You probably spend more time with your colleagues than you do with some of your family members, at least waking hours, right? And so what I would suggest is think about how you are in this together. What is your shared mission? Why are you all doing what you're doing? And connecting with each other and investing in each other as team members is a way that can enhance meaning at work and also buffer you from the more difficult aspects of the system. When it comes to clients, they're really the focus of why we're doing what we're doing, right? Like the patient is why I'm here. If we didn't have patients or clients, we wouldn't have jobs. And so investing in that therapeutic relationship with those folks is really a primary goal of what we're doing. And that also means navigating the difficulties and challenges when it's hard. One of the ways, this is probably not new to you, that we can really enhance relationships is through positive communication. In training, you probably learned this, but really listening, empathy, and nonverbal communication are really important ways that we can demonstrate to somebody that we care, that we respect them, and that we value them. And I really like this quote from Maya Angelou that she says, "People will forget what you said, they'll forget what you did, but they'll never forget how you made them feel." And I think about this as a patient myself, right? Like facing something that maybe can't be cured, can't be fixed, it's something I'm just gonna have to live with. That could be demoralizing for my providers to have to tell me that, but what I remember is that they care about me. They've communicated to me in a way that I'm like, I feel supported in this. I don't feel alone, and I'm more likely to come back and reach out to them when I need something. And I think that's a fundamental part that sometimes we miss, is that even when we can't fix the thing, if somebody feels supported, that's good for them. So how can leaders help when it comes to relationships, or things that leaders can focus on to help people enhance meaning in relationships at work? I would say to help team members prioritize quality time with patients and colleagues, period, right? And human-centered technology that allows to kind of reduce admin burdens is a really good way to do this. And we just got to start using AI abridged technology, right? I think that's something that the system has done to try to enhance people's quality time with their patients and reduce that admin burden. That's a big one. Also, assessing and addressing workplace culture, essentially ensuring a culture of respect, is an absolute necessity for leadership. Providing opportunities for collaboration. We are social beings, relationships are important, and we tend to thrive when we can help each other and create things together and innovate together. Even the introverts of us like to, maybe one-on-one, not in a big group, but do those team projects. And then find ways to demonstrate that team members are valued. And that's not a one-size-fits-all thing, right? Every person is going to feel valued in a different way. So it's really on the leadership to understand their team and what's going to be motivating and feel good to each of the team members, and really conscientiously doing those things. Okay, so let's move on to cognitive meaning at work. When we talk about the cognitive meaning at work, we're really talking about the cognitive models, the thoughts, the beliefs, the perspectives that we bring into our work that can be a significant source of meaning or disillusionment. So thoughts and beliefs have a really powerful influence on how we feel and what we do. What I tell myself about a certain situation is going to have a profound effect on the emotion that I experience and what I'm motivated to react to that situation. And so it's really important for us to be aware of and adjust the models that affect our well-being and our sense of meaning on the job. The intellectual virtues that Ed mentioned a few moments ago are really key to helping us adjust our cognitive models at work. So in order to change the way I think about something, I have to be curious about it. I have to want to know what I think about that thing instead of just kind of floating along, right? I have to be open-minded to the idea that maybe the way I'm thinking about this or the way I'm conceptualizing this isn't helpful or isn't accurate or isn't complete. And I have to be humble enough to say, maybe I'm not right. So two of the ways we can address cognitive models at work that are challenging, some of our cognitive models are great, right? Like people are worthy of care. That's a good model, don't change it, right? Some of them aren't serving us very well, however. And there's two different ways we can approach this coming out of cognitive therapy and then another model of therapy called acceptance and commitment therapy that address some of our models are biased, or they are incomplete, or they're just flat wrong. And some of our models are true, but they're really difficult for us to accept. And there's two different things we can do here. One is if that model is biased, it's not working for us, it's incomplete, it's wrong, then we can work to change the model, right? And we can ask ourselves some questions like, what's another way of looking at this? What's another explanation? What else could be true? Is there evidence for this, right? And really what we're getting at is what's a more helpful way for us to think about this situation. So it's willingness to say, I don't think I'm seeing this in a helpful or accurate way. What's another way for me to look at this? What we can do for accepting hard truths is really just acknowledging them and then being able to say to ourselves, if this is true, what do I want to do about it? Where do I want to focus my energy? And I think an example of this that I really like, anybody know MASH? Fans of MASH? Okay. There's the concept of rule number 1 and rule number 2. Rule number 1 is that young men die in war. Rule number 2 is that doctors can't change rule number 1, right? I think that's so applicable to what we do in healthcare, is that we will run into situations where we can't change whatever it is for the person, right? And we have to accept that. But then we can ask ourselves, if rule number 2 is right, what else can I do? How can I live with that truth and do something else meaningful anyway? So it's kind of defusing from the helplessness that comes from accepting that hard truth. Lastly, for cognitive work, learning. You probably all got in the second highest poll answer was like being involved in research and discovery, right? We all love to learn. So look for opportunities to continue to learn, to grow, to foster, your passion for whatever it is that you do. A lot of us do this. We listen to podcasts, we read journal articles, et cetera, et cetera. Continuing to do that can be a really nice buffer against the difficult aspects of the system. And how leaders can help is honestly acknowledge the tough stuff. Have transparent conversations about it. You work with really smart people. You can't pull the wool over their eyes. Just be transparent about it. Involve team members as much as you can in decision-making processes. How are we going to roll out this process, this procedure? Do bottom up as much as is feasible. Leverage the smarts that you've got in the room. Provide opportunities for training, learning, growth. And then honestly, one of the biggest things you can do is just model this willingness to change perspectives or adjust the model, right? Like, if I wasn't right, say I wasn't right. I got that one wrong. We need to try something else. Okay. Experiential avoidance, as Ed mentioned earlier, can be a significant source of distress. So when it comes to meaning, if I'm not engaged in my full experience, I'm going to be missing out on a lot of things. And so what I'd like to propose to you is going in with an attitude of experiential acceptance. So making room for those unwanted or those unpleasant experiences, that really allows them to come and go naturally. So let's talk about how we can do that. But first of all, do I really need to do that? That's the main question I tend to get. And no, you don't have to. But if you don't, you're probably not going to feel the good stuff either. And this comes out of a lot of psychotherapy traditions, but one of the most recent ones is positive psychology, kind of second wave, that acknowledges that many of our most meaningful experiences are what they call covalenced. They have dark sides. Oh boy. Let me close that out. Okay, they have dark sides to them, they have light sides to them. And we can't experience the light side if we don't experience the dark side. Compassion is a really good example of this. So in order to have compassion for somebody and really connect with them on that level, you have to kind of take on their suffering and experience some distress. And that's a main component of what we do in healthcare, is meeting somebody in their suffering with compassion. It feels good to do that, and it can hurt at the same time. But if we don't experience the hurt, you can't really be in it with the person. Now, fully experiencing at work is not without risks. And many of you have probably heard of the concept of compassion fatigue. Charles Figley has been researching this for decades at this point, but he has demonstrated that in our effort to view the world from a perspective of suffering, we suffer. And so it's important for us to have mechanisms for experiencing and being fully present at work that don't set us up for just being completely devastated. And here's some of the things we can do. Deliberately experiencing can help balance out some of that tough stuff. Gratitude and savoring, Ed mentioned earlier, there's tons of research to support using these to balance out well-being, and they can be effective in increasing well-being scores even if somebody continues to experience depression and anxiety. So it allows them to kind of experience a full range of things. So cultivating practices around gratitude and savoring is a really good thing to do. Additionally, connecting with others can help validate and normalize your experience, right? Talking with coworkers about what is it like for you when X happens can really help you know I'm not alone, I'm not broken and feeling this sadness or whatever it is that you're experiencing. A note of caution there that can become toxic, so you gotta be careful, and it's gotta stay kind of supportive and not, sucking you down into toxicity. Say that 3 times. Additionally, things like mindfulness practice. I like to think about mindfulness as a surfboard. So the waves are going to keep coming, but mindfulness, if you're on the surfboard, you can surf the wave, right? And it can come and go. And it's a great practice to get into that allows you to just recognize your emotional experience, feel it, and then let it kind of dissipate on its own. So cultivating a mindfulness practice is really helpful. And then Ed also mentioned authenticity, which is a topic in and of itself. There's a good book called Authentic that's by Joseph that I would recommend for everybody. But practices that help you connect with yourself and who you really are can also help you be experiential and buffer you against that, provide a buffer against the really difficult stuff. So how can leaders help? Acknowledge and validate the dark side experiences as normal parts of our work. Don't sweep it under the rug, right? Be honest about your own experiences and really normalize that for your people. Additionally, avoid putting the onus solely on the team member for their emotional well-being. Acknowledge the difficulties of the system and the difficulties of the work we do and say, we're going to help with this. What can we do to set things up to make this more sustainable for you? Fight stigma associated with compassion fatigue. Encourage people to get help. Encourage people to take breaks. Encourage people to prioritize their own well-being and have mechanisms set up for people to do that. And then lastly, purpose at work. So a sense of mission is really vital, but it tends to only go so far as we run into the day-to-day, right? So like I can come into work and I'm like, I'm gonna be the best psychotherapist I can be today, and then I go to log into my computer and I'm locked out of my account. That can shoot my whole day's worth of purpose, right? And not to minimize that, because it really can be a difficult thing, but I like to go back to, why am I doing what I'm doing? Why am I here, right? Okay, if my technology's not gonna work, what can I do to do what I'm supposed to be doing at work? And so think about these things. What's important to you? A concept that comes out of acceptance and commitment therapy that I love for this is something called value-centered action. So think about your ideal. Why do I do what I do? What's important to me? And then what are the core values that really relate to that? And how can I make decisions in the day-to-day of like, I need to do this or I need to do that? Well, what's most value-centered for me? And try and make those decisions off of values. And it's not just for big things, it's for small things too. When I call IT and I say, please let me into my account, if value for me is to be really, really nice and compassionate, I'm gonna do that to the IT person, and then hopefully they will carry that to the next person and the next person that they work with, that degrees of influence idea. There's lots of things online you can find for values clarification exercises. You can do them individually, you can do them as teams, you can do them as large groups. I would encourage you to do that for yourself and then revisit it at regular intervals to ask yourself, how congruent am I with my values at work? Do I need to change anything? Can I adjust my work to make it more value congruent? Can I adjust the way I approach something that I have to do at work that doesn't feel really important to me in a way that is more value congruent? We all drift from values, so revisiting that can be really helpful. And then be deliberate about reminding yourself of why you're doing what you're doing. Go back to your ideal and remind yourself of that regularly. Lastly, for purpose, teaching is huge, right? Teaching is a great way that we can get lots of benefits with regard to purpose in one shot. So I'm helping the students, but I'm also helping the patients of the students. And then I'm helping their families. And I'm helping myself learn something else. The more I teach, the more it reinforces it for me. The more I want to learn more about whatever it is I'm teaching, right? So like it has a multiplicity of effects. So wherever you can share learning and expertise, do it. It's a great enhancement of purpose at work. Lastly, how can leaders help when it comes to purpose? Ensure that asks are mission related And what I mean by that is when we ask people to do things, tie it back to whatever the mission or the ideal or the values are, as much as you can. Get to know what's important to each team member and try to set them up with congruent duties, right? You'll have a big variance in what's important to members of your team. And if you can align people with things that have to get done with what's important to them, you're gonna have a really effective and happy team. Fostering autonomy and giving people the ability to work at the top of their training is another really important way to foster purpose, because the top of their training is likely as congruent with the ideal as they can be, and that's gonna really enhance a sense of meaning for your people. Whew, okay. So we want to thank you all. And we are open for questions.
You guys might have noticed that we are using 2 different audio systems in here. One's for the sake of our recording. So this one is going to be for the recording specifically. So just raise your hand if you have a question, but then speak at a normal cadence for our Zoom participants as well.
And I can't hear what you're saying. But
it's on for the recording, I believe. Okay, so it's on for the recording. Everyone can hear on Zoom, so. Any questions?
Sorry guys, just to reiterate, so if you have a question in room, just speak a little loudly. We have overhead mics for everyone in Zoom, and the handheld mic is for recording, so we apologize for that. So just speak a little bit louder, and we will do our best. Thanks.
Okay, so I guess I'll move the mic a little bit away from me. I really appreciated how you both connected the talk, and I like this is more of a comment question. I like the part where you mentioned that it kind of has to also transform with the smaller requests or the smaller asks we have. We almost forget that the action is behavior or language. I guess it's the other way around, that action is behavior. I'm not sure. Yeah, I often struggle with that myself, where I'm thinking, well, I guess I am helping somebody who fell off in front of me, so that's a big thing I'm doing. But then am I really helping someone when no one's looking? And I often feel like that's something I struggle with. So I guess the more I'm learning with conversations like this, I feel like the smaller things matter as much. Need to give that importance so I can continue that. But yeah, that was a comment I had.
I think, I have to do this.
Yes.
Sorry. I think I heard everything you said, and I appreciate that. I do think it's really important for us to, because it's almost death by a thousand cuts in a lot of ways, of like these small asks or these little things we have to do that really add up over time and can really kind of diminish our sense of meaning if we don't really connect them with what we're doing, with the ideal, with the mission. So I appreciate that.
So both of you work here, right?
Yes.
So, and by the way, I just want to say thanks for the coherence of what you just presented. Your emphasis on how important coherence is, that was a really coherent presentation. I want to thank you for it. Would you mind applying to yourselves in your current working conditions, like coming to work to be the best psychotherapist you can be and not being locked out of your computer? How are you two applying this at the University of Colorado?
Yeah, I struggle with this. I'll admit that, because I'm just as susceptible to all of the frustrating things about working in a system as anybody else. And there are days I'm better at it than others. But I do think some of the things that I talked about today, really the one that I always come back to is, why am I doing what I'm doing? What's important to me right now? And usually it's the person sitting across from me, right? So like if the IT stuff is going on, or I have a talk I have to prepare for that I don't feel prepared for, not that I've felt that recently, or anything else. If there's that person sitting in my room across from me, then I want to lock in and say, this is what's important to me right now. And the other stuff might bite me in the butt later, but I'm going to really focus on this person. That's what I've done to really kind of help. As a leader, all the things I suggested, it's simple, but it's not easy. And so I think I've just done my best to try and encourage everyone else to do that as well, right? Like, if you've got competing priorities right now, do the one that feels most important to you. Do you want to add on to that?
Sure. So for me, if you think back to the triangle that I showed with the balanced meaning model, which one was at the top? It was relationships. Mm-hmm. So for me, the core thing that keeps me going are the meaningful relationships that I have with my patients and with my colleagues, such as Amy and some of you here in the audience. That's what really keeps me going. And thinking of the patients that I'm working with, and the staff too, but particularly with patients, valuing them and trying to understand the cognitive aspect, their stories. What's going on with them? What brought them here to me today? And their experiences. Being okay with the emotions that they bring into the room, and because they're suffering. And my job is to help them out. And then the final part is having a sense of purpose. My job is to help them out in whatever way, shape, or form that I can. And that's my duty, and I'm going to do the best that I can with every patient. That is my challenge. If you think about that, how Frankl had put it as, what is life asking of me now? Well, that's my challenge in the here and now.
Oh, thanks. Great. I thank you very much. I appreciate the importance of finding meaning and through challenge and how we grow as human beings. You also stepped back and you cited Vivek Murthy's work around improving function, or it might be Wendy Dean's work around moral injury. And one of the challenges that we have is that our systems are created right now that promote moral injury. And so we want to be able to help people do better in finding meaning through their struggle. But for Viktor Frankl, we would also say it's important to not put people in prison camps. And so part of the leadership perspective is to help create environments that don't have moral injury and help people create this. So it's not just my issue of finding meaning through my struggle, it's finding ways to decrease the struggle. And I worry sometimes in talks that we put too much of the burden on the wounded healer and not enough on the system. That's more comment than question. Do you want to comment?
I'm just glad you said that. Because honestly, as I was preparing for this, that was the last thing I wanted to do, was to put the onus on the individual, because it's hard to be healthy in a sick system. That's one of the reasons I was so encouraged by seeing the Surgeon General's report from a few years ago, is that at least somebody was, when the baby's ugly, call the baby ugly, right? At least somebody was calling the baby ugly and willing to say, we've got to change the culture. We have a cultural systemic problem that's contributing to these folks feeling pretty distressed by what they are faced with day to day. So I just appreciate your comment.
Other questions?
I have to speak in both. Okay, so I'm aware of the literature on well-being, and then there's this other literature on meaning in life, and there are a few scholars who are kind of making inroads between those two. And I'm just wondering if you can maybe comment on that, the relationship between well-being and actually mental health and then meaning. Last year we did our strategic plan, and I think our top priority was around the people in our organization, our department, and their sense of well-being. And we have a work group that is specifically designed to kind of focus on faculty, staff well-being. So I'm really interested in what you have to say about that, the relationship between well-being and meaning. So
I kind of think of them as being kind of similar to the congruence Venn diagrams diagrams that I had shown before, that they're related topics, but they are different. And I think it's important for us to consider both at the same time, that because they are bringing unique aspects to the equation here. I'm not as familiar with that literature, but I can certainly see the conceptual overlap. And that does make it a bit confusing when you're using different terms that have a lot of overlap. And I think that that's something that we have to explore and understand more fully so that we can apply it as best as possible.
I'm wondering if either of you can comment on the application of what you've presented here to second or third victims who work within our healthcare system that we may be called on to support.
So the downstream effects, right? So like it impacts more than just the person who's involved. So we have to think about when we have negative outcomes, that they're not just impacting the one person or the small team that was involved with it. And in fact, it's kind of that, actually the 3 degrees of influence is a nice way of capturing that idea. It's not just the 1 or 2 people, it's the people beyond them. So if it's impacting the doctor and the nurse, well, it's impacting the doctor's team, the nurse's team, and then it's impacting the floor, and so on and so forth. And we need to be mindful of that and assess what are the downstream effects here, because it can show up in weird ways, ones that would not actually be expected. So we have to ask those questions. And to me, it's kind of similar to the way that we would approach a quality project, right? We have to think of everyone who would possibly be involved and get their input in order to figure out what is the best pathway forward here. So it can't just stop at that singular person or 1 or 2 people. It's got to be the entire group and expand it out from there. So I think that's the most humane way of doing it here, because we could end up having people who are adversely affected and we never even know it. And we also have to create an environment where it's okay to say, hey, I wasn't directly there, but I had kind of a vicarious traumatization.
I think the only thing I'd add to that is just taking a trauma-informed perspective into everything we do, and kind of being aware that even though someone might not be a direct experiencer of something, they bring their own stuff into this that can be activated by even hearing about a situation. And so just making sure we have that trauma-informed perspective and allowing for people to have space and choice and autonomy and all of those things is really important.
I was wondering if part of the things that leaders can do would be to and I'm wondering if you think that this would be helpful, is to have them communicate when they have pushback on the system or the things that they've done to try to make things better, even if it doesn't turn into anything. I still feel like sometimes we need to hear that there's fight for us. There's fight to change.
Yeah, 100%. Anything you would add?
Yeah, I think we need to put forth our best effort to help out our staff, but then we have to communicate it back to them. It's not terribly helpful to the staff if we do it in a vacuum and we never actually share the good efforts that we're making. The staff understand that we as leaders can't necessarily change everything that's happening, but they expect that we try. It kind of ties nicely into the idea of servant leadership, which is something that Amy and I definitely buy into. So we have to communicate what we're doing. And also, while we're trying to figure out what it is that we're going to do, kind of like what Amy was saying, the bottom up. Okay, we've got this, in the VA, we would call it an unfunded mandate. So what are we going to do about this here? And not to have it be something that we at the leadership level are trying to address, but we solicit the input of everyone, because who knows, they may have a brilliant idea that actually really helps out quite a bit. But if we don't ask and we don't communicate with them, that could end up being a problem. So I think the transparency and then soliciting other people's views, I think, is important. Great questions.
Looks like we have a couple questions online.
All right, so the question kind of begins with, I think the gap between hearing and digesting this information as individuals and actively working on this improvement in the workspace can be a challenge. What are some ways that we can adapt these concepts into action to improve our working relationships?
That's a wonderful question here, and I think that there's a lot more that needs to be done with this. So this is the first step. This is getting forth the ideas and putting it together. We kind of twisted Myra's arm to do this as the Grand Rounds and put it together here, and I think it's come together very nicely. It does, I agree, I like the term coherence for it. It comes together very nicely. But we also have to figure out what are the next steps. Myra last night at dinner had mentioned workshops, and I think that's a good way of doing it. But I think that there's got to be a lot of extra steps here. This is the beginning, certainly not the final product here with this. But I think that this is something that based off of all the questions that you've had here and just your interest, this is something that you all are looking for as well. So we need to figure out what are the next steps, and not just at the leadership level, getting participation from all of you as to how can we make this effort as meaningful and impactful as it can be.
And I would just add things you can do right now. Just pick one thing, start really small, and try to develop a deliberate practice around it, right? So if you want to enhance relationships at work, think about the concept of unconditional positive regard and how can I kind of make a practice around reminding myself about that idea that everybody is worthy of value, right? Or if it's around purpose, think about how can I infuse my day with purpose. Or if it's experiencing, maybe there's a mindfulness practice I can start to cultivate. So just like start small, start with one thing, and that can build some momentum.
So I want to add one other thing, and to tie Amy's part with my part here is don't just think about it as meaning at work. Meaning at work is just one part of meaning in life. So we can do things individually and through the people that we care about and find other ways towards finding meaning in our lives. So this is just a specific aspect of it. So I want to make sure that we highlight that.
Perfect. Thank you so much. We do have another question that kind of begins with a comment. So understanding patients' stories agree completely and ties in with narrative medicine. Of course, the problem is that relatively few physicians have either the interest or time to hear the patient's stories. How can we change this when the institutions of medicine so often seem antithetical to the broader implications of healing? A side note, narrative medicine and the idea of listening to the patient's story is key in Indigenous medicine.
Absolutely. I agree with that final part 100%. That's a critical part of Indigenous wisdom and healing. And I think that's part of why it can be so useful. But I think that patients do understand, particularly in primary care settings or family med settings, that we don't have as much time as we would like. And it's okay to say, I don't have as much time as I would like, to acknowledge the obvious. But then to also say, when I am interacting with you, I want to hear your story and I want to understand it as best as possible with the time that we end up having. And to say, oh, this relationship that we have is important and it is ongoing. So maybe I'm not going to get the full story of your life today during our first visit, but there are going to be follow-ups. There's going to be multiple opportunities for me to hear your story and to put it together. And so I love the idea of narratives. In fact, I would go as far as to say it's our unit of meaning. We talked about domains, but we organize our lives around stories. So it's really important to hear the story of the patients. And just sometimes having the patients tell their stories can be very therapeutic. We mentioned Carl Rogers, who created person-centered therapy. That's exactly what person-centered therapy is. It is a way of facilitating patients telling their stories. So I think that we do the best that we can. We acknowledge the obvious, and we encourage patients, like, when I am here, I'm going to be as fully present as possible. And I do like the idea of AI Abridge, because it helps us to be fully present with the patient, because we don't need to be typing on the computer.
Any other questions in the room? Great. Myra, it's all you.
I'm not going to give Ed full credit for the arm twisting. I think it was more the other way around.
It was both directions.
No, I think last year's in November department meeting where we talked about gratitude and savoring, it was really something that was well received. And then, as we talked about, as Gil was mentioning, our top priority in our strategic plan is about our people in family medicine. As I was thinking about well-being, what is the role of meaning? That basically what Gil was talking about. What's the role of meaning in our work to our well-being at work? I'm not talking about, everybody's life outside, although that's important, but, really what can we do as a department to help people connect to meaning in their work? And that's why at the State of Department, I was saying, it caused me in my own personal health journey to reflect on, why do we exist as a Department of Family Medicine in a medical school? What is our purpose for being here? And really starting to reflect on how each of us, even if we're not directly interacting with patients or in patient care environments, has a purpose in achieving, has a role in achieving that broader purpose. To enable the teaching to occur, the research to occur, the things that we need to carry on for why we exist as a department. So I want to thank our speakers for bringing that, and I want to thank everybody for attending. And sure, yeah.
So I should probably take those too.
Technology.
Yeah, absolutely. Gotta love it. This final slide is actually really important. As I said, this is the beginning of this journey here. This is not the final product. And we, like we've been talking about, are open to suggestions for what the next steps are or how we go about improving it. So we've included our emails here, and please feel free to reach out to us if you have any thoughts or questions or anything, because we think that there's a lot more that can and should be done in this area. So I would love it if we get dozens of emails and have to respond to them, because that means that we've gotten people thinking about it, the cognitive meanings, if you will. And we can work together to figure out what are the next steps. So thank you so much for coming here. This has been a wonderful experience for us here, and we really appreciate Myra and her team and the Department of Family Medicine for allowing us to host this wonderful Grand Rounds. So thank you to everyone.
Oh, there's an opportunity at 3 o'clock in 3101 to meet with our speakers in a small group. If you've had some questions or ideas that come to mind, you have opportunity to share them just in basically an hour. So please, encourage you to do that. And that 3101, it's the conference room on the 3rd floor in A01.